The aim of this video is to orient you to the use of the Sonosite ultrasound machine and to teach you the basics of ultrasound. This is the Sonosite ultrasound machine. One can be found in each of our ICUs on a rolling cart. While each can run on battery power, they should be plugged in whenever possible. Each machine has several probe types attached to it. For our purposes, we'll be using the vascular probe, a higher frequency probe. To select a probe, press the button above the probe's cord. A green light indicates which probe is active. Let's take a closer look at the Sonosite machine controls. This is the power button. The image generated by the ultrasound probe is centered on the screen. The top of the screen correlates with the tissue closest to the probe. On the right of the image are markings denoting the scale of the image. The depth or the scale of the image can be adjusted by pressing the depth buttons. To adjust the quality of the image on the screen, use the gain buttons. The gain of the overall image or just the top or the bottom of the image can be adjusted. Turning up the gain makes the image brighter, turning it down makes it dimmer. Note the green dot oriented on one side of the ultrasound screen. This dot corresponds with the notch on one side of the ultrasound probe. This helps with proper orientation. Usually when imaging a structure in the transverse plane, the operator is facing the patient and the notch is pointed to the patient's right. When imaging a structure in the longitudinal plane, the notch will be pointed to the patient's head. However, for placing an internal jugular central venous catheter, since you, the operator, will be standing at the head of the patient, the notch should be pointed to your left and the patient's left when imaging structures in the transverse plane. Now we'll use the vascular probe to identify the internal jugular vein. Rotate the patient's head away from the side you are trying to identify the vein on. Remembering our anatomic landmarks, the internal jugular should be found at the apex between the heads of the sternocleidomastoids. The internal jugular and the carotid will appear as two dark circles on your screen. To differentiate between the internal jugular vein and the carotid, press down gently with the probe. The vein should compress easily, while the artery should remain patent. The artery may even be pulsatile. Slide the ultrasound probe up and down the neck to identify the area where there is the least amount of overlap between the carotid artery and the internal jugular. Overlap of the two main vessels of the neck can also be adjusted by changing the rotation of the patient's head. If there is still a question as to which vessel is the vein, or if there is flow in the vein, Doppler imaging can be used. The ultrasound has several modes. Up until this point, we've been in 2D mode. The ultrasound has two additional modes, Doppler and color. Doppler mode creates a wave tracing and audible recording of the flow movement captured by the probe. Doppler is best obtained with the vessel imaged in the longitudinal plane. Doppler will not detect the flow perpendicular to it. It is best to place the probe at an angle to the vessel. In Doppler mode, you will see a long vertical line transected by a short horizontal line in the middle. The long line represents the angle of the ultrasound probe. Press select and using the touchpad, move the short horizontal line into the middle of the vessel. Once your lines are properly positioned, press the Doppler button again to produce the flow signal. This will generate both the audible, pulsatile flow signal of the vessel, as well as the visual wave tracing of the pulsatile flow along the bottom of the screen. The wave tracing has a time scale across the horizontal axis, as well as a velocity scale along the vertical axis. A venous tracing will have lower velocities without the high peaks of the arterial tracing. This is a venous tracing. Compare it to an arterial tracing. Next, press color to enter color Doppler mode. This will highlight areas of flow and directionality within the ultrasound probe's plane with color. Upon pressing the color button, a box will appear on the screen, the ROI, or region of interest. Use the touchpad to center the box over your vessel of interest. Again, angle your probe so that the plane of the transducer does not transect the direction of flow perpendicularly. Usually a 60-degree angle to the vessel is ideal. The color key is at the top corner of the screen. Colors on top are moving towards the transducers, colors on the bottom are moving away from the transducer. Arterial blood, shown as blue here, is moving away from the transducer, while venous blood, shown as red here, is moving towards the transducer. You are now familiar with the use of the ultrasound machine, the vascular probe, and its various imaging modalities. These skills will be essential to placing an ultrasound-guided central line, which will be discussed in later videos.